maybe due to some network problem, she may be suffer. She may not be, or she may be joining from other laptop or something. As you all know that varicose ulcer is one of the area where homeopathic doctors can do wonders. And usually these varicose ulcers are a result of stagnation of blood, venous blood, the lower part of the feet, or I must say leg. And because of that, the drainage to the upper part is being blocked by the walls in the veins. And due to the irritation there, sometimes you may scratch, and as a result of scratching, there may be formation of ulcers. So simply, some people may think that it is a simple thing, but when in the early times, it may go up without treatment, but gradually it become a deep one, and once it become a depth, the depth of the ulcer become large, they may find it. They may consult firstly to the, sometimes it may go to a dermatologist and they may take medicine for that, and they may give some antibiotic as well as some other uh, drugs which may suppress the as well as some externals that may suppress the problem. But on the later part, when it appears again and again, they may find it very, very difficult to they may find it very difficult to walk. They may find it very difficult to do their daily routine. So then somebody may advise them that there is something called a homeopathy. There are a very good treatment in homeopathy. So those people may go there, and once they visit to a homeopath, they may look into the detailed case taking, and then you may find they may surprise. Oh, why this doctor is asking my family history, what about the sex, menopause, and all those things, menses, and everything like that. Yes, Dr. Manoj.
Yes, she will join some technical problems. She will join soon. And she
Okay.
informed that she share the screen sharing to you, Dr. Tanesh.
But it is very difficult for me to share because I have not downloaded it,
Yes.
uploaded it to.
Anyway, she will join now.
I have sent it to Dr. Hibbert, but whether he is available or not.
Some technical problems. She was not able to. I advise her to join through the mobile phone. That is the reason.
You please call Dr. Hibbert also.
Yeah. Okay. Okay. Yes. Yes.
So naturally, every homeopathic doctor, you just forget about this as Dr. Amrutha is joining, and yes, whether it be a case of ulcer or something else, whatever be, we need to take the case in detail, whether it be on right side or left side. That is the way a homeopathic doctor used to take the case. Yes, yes, Dr. Amrutha is here. Yes, Doctor, you are the co-host now. You can already I have introduced yours. Good name.
Good evening. So good evening, sir.
Yes, yes, you can talk. Oh, your network is so weak.
So is the screen visible? Sir, I have shared PT with you, sir.
Yes,
Will you
yes,
be able to screen share it, sir?
yes, yes. That's coming. You are muted, Dr. Amrutha.
Sir, may I start?
Yes, please proceed. It's already late. Please.
Okay, sir. Sir, is the screen visible, sir?
No, no,
Come
no.
on.
No, sir.
Please.
Ganesh, sir, please share the screen, sir.
So, you may start speaking something in between. Dr. Hibbert may share other.
Okay. Okay, sir. Okay. So, good evening, on and all. So, our topic today is varicose ulcer and homeopathy. So, first of all, pranams to our beloved master Samuel Henneman and pranams to my teachers. So, varicose ulcer. Varicose ulcer is also known as venous ulcer or venous stasis. It is a leg wound that happens when the leg veins do not circulate blood back towards the heart. Okay, this is the problem with the circulating system and also the problem with the veins. It is a type of vascular ulcer. So, varicose ulcer is one of the most important complication of varicose vein. So, varicose ulcer mostly occur due to injuries happening in the lower extremities, mainly due to the improper working of the valves. So, this is the normal leg with the normal functioning valve, and this is the picture of varicose vein in which the valves are not functioning and there will be tortuous valves will be there. So, venous insufficiency syndrome are the most commonly caused by valvular incompetence in the low pressure superficial venous system and also in the high pressure deep venous system. So, regarding the venous circulation, we know that we have a superficial veins in the lower extremities and also the deep veins in the lower extremities. Both are functioning simultaneously for the blood supply. So, this venous insufficiency may affect both the superficial venous system and the deep venous system. And the deep venous system is supposed to be a high pressure venous system. So, in addition, they may be as a result of some congenital absence of the venous valves. The term varicose ulcer or post-thrombotic ulcer or the gravitational ulcer is used as a synonym of varicose ulcer. So, this is what we have told from the beginning. So, Sir is now sharing the PPT
Yes.
and I will repeat once again. That is,
No,
we have
you-
just said about the varicose ulcer. So, varicose ulcer occur as a main complication of varicose vein, mainly due to the valvular insufficiency or the problem with the valves of the lower extremities. Okay. So, it may affect both the superficial as well as the deep valves.
Yes, Dr. Amrutha, you may continue.
Okay, sir. Okay, sir. So, the next slide, please. Okay, we have said about the varicose ulcer. This, sir, kindly put it in the screen share view, then it will be visible. Screen share, the next option near to it. The slide view, then will be visible in enlarged way. Yes, the slide share view, sir. Near to that, the slide share view.
From the top, doctor. On the top of the left extreme, we can see the slide sharing option.
Okay.
Yes, slide show. Now it is right. Correct.
Okay, sir.
You may go because time is
Okay,
already
okay, sir.
finished.
So the main pathophysiology of varicose ulcer. So the 8th slide. The main pathology of varicose ulcer is mainly there occurs a venous hypertension. When there occurs venous hypertension, there occurs edema of the lower extremity. When there occurs edema of the lower extremity, increased capillary permeability will be there, which automatically lead to the leakage of the fibrinogen. And the fibrinogen leakage lead to the fibrin clot formation, which in turn decreases the oxygen absorption and carbon dioxide removal, which in turn lead to the ulceration. So this is the simple pathophysiology of varicose ulcer. So the first main thing is the it forms as a complication of varicose vein. So varicose ulcer as a complication of varicose vein, this varicose ulcer is forming, and this is the main pathophysiology. First, there occurs a venous hypertension. As a complication of venous hypertension, there occurs edema of the lower extremity. When there is edema occurs, the capillary permeability and the capillary pressure will be increasing, which in turn lead to the leakage of the fibrinogen and the fibrin clot formation, thereby decreasing the oxygen absorption and carbon dioxide removal, which in turn lead to ulceration. So, next slide, please. So, there occurs a venous hypertension along with the venular hypertension and capillary hypertension. All these together forms lead to interstitial hypertension, which in turn lead to the ulceration. Okay, this is the main pathophysiology. So the next slide, please. So the main causes and risk factors we are discussing. So first one is varicose vein. So as a complication of varicose vein only, the varicose ulcer will develop. There are the swollen bulging vein that occur when the valves in the veins do not function properly. Next one is age. As the age increased, the weight bearing and also the old age, as the patient get old, the chance of developing varicose ulcer is more. Next one is obesity. As the weight increases. Next one is as a complication of some cardiovascular medications, then other due to any diseases, including the arterial disease, diabetes, and the arthritis. So next slide, please. Then other risk factors for developing varicose ulcer is obesity, and then history of any DVT, that is a deep vein thrombosis, or a family history of venous insufficiency, smoking, pregnancy, and fracture of the long bone of the legs. These are the precipitating factors that lead to the formation of the varicose vein. So varicose vein, overweight, history of any DVT, then history of any hypertension or chronic venous insufficiency, smoking, pregnancy, any fracture. So next slide, please. So next slide. So these are the symptoms and signs of varicose ulcer. So there are many symptoms and signs of varicose ulcer. So first one is the skin change. Before the ulceration, there will be discoloration of the skin. Discoloration of the skin, and due to the lack of oxygen supply and also the carbon dioxide accumulation there will be discoloration of the skin, and sometimes it may lead to itching. Okay, in most of the case, there will be itching will be there, and the itching ultimately lead to the ulcer formation. Ulcer formation of the skin. There will be discoloration or darkening of the skin, then it will lead to the formation of the ulcer. The pain will be there. The characteristic of pain will be aching pain. There will be aching pain will be there. Then there will be swelling of the lower extremity, angles, and the lower limb. So next slide, please. Then ulcer. Ulcer formation, usually it will develop a shallow ulcer, and sometimes yellow tissue will be there. We will be discussing about the ulcer cleaning method, right? Then the discharge. Sometimes there will be foul smelling discharge from the ulcer. Sometimes blood discharge will be there. Next, the stages of venous insufficiency. So next slide, please. So these are the stages of varicose ulcer. Just understand this. This is very simple, and the whole pathology lies in this, the physical appearance. So first, there will be a spider vein appearance. Okay, before the appearance of varicose vein, there will be a spider vein appearance. Next stage is the stage of varicose vein. The third stage is the stage of swelling or edema. And the fourth stage, we can elicit the skin changes. That is the skin discoloration, reddish appearance of the skin. And the fifth and sixth stage, it is the final stage that leads to the venous ulceration. So, first there will be spider veins appearance. Next, it will lead to the formation of varicose vein. On the third stage, there occurs edema or swelling. And the fourth stage, there occurs skin change. And the fifth and the sixth stage, it lead to the varicose ulcer. So this is the stages of venous insufficiency and the varicose ulcer. So next slide, please. So here we can see in the next slide, we can see the appearance of the normal vein and also the varicose vein. So next slide, please. So this is the normal vein. Okay. On the above picture, you can see the normal vein. That is the normal vein will be there, normal valve will be there, and the normal blood functioning. On the picture below, you can see there is a abnormal condition of the vein. As a complication of varicose vein, there will be damaged valvular system and also the abnormal blood flow. So the other symptoms of varicose ulcer it include the varicose vein will be there and swelling and enlargement of veins of the legs. And first there occurs an eczema formation. Usually the initial presentation will be red color. Okay, reddish color, later eczema formation, and then there will be some flaky or scaly appearance. As a complication of this varicose vein or as a complication of this varicose ulcer, the patient may develop burning pain, especially at the night, and which may in turn lead to sleep disturbances. As a consequence of it, it later lead to depression and fatigue. So next slide, please. So these are the common symptoms of varicose ulcer. Next slide. So this is the symbol picture which represent what are the symptoms of varicose ulcer. So first there will be itching of the skin. Okay, there will be edema. We have already discussed in previous picture that first there will be spider navy appearance. Then it lead to the varicose vein formation. On the third step, it will lead to the edema of the legs. So edema of the legs then ultimately lead to some itching of the skin. Okay, itching and a tingling sensation will be there. There will be leg swelling will be there and crampy pain will be there. The appearance, it will be a dark red or purple appearance. So next slide. So this is the main methods to prevent the varicose ulcer and varicose vein. So mostly the persons occupation-wise, teachers, conductors, or the petrol pump workers, etc. As the persons who are standing alone is having having a risk of developing this varicose vein, which in turn lead to varicose ulcer formation. So first one is quit smoking. So one of the disease which associated with the smoking and disease of the lower extremities is TAO, that is the thromboangiitis obliterans or the Berger's disease. It usually occurs in smokers. Okay. So smoking, the nicotine poison in the smoke, which lead to the development of this ulcer formation like that. So the main preventive method include first to quit smoking, to exercise regularly, regular exercise and losing the weight and reduce the amount of salt in the diet. So why the salt is being avoided in skin conditions? We are preferred to reduce the salt and also the more protein-rich products. Okay, the salt is having some irritant properties. In skin complaint, we usually advise the patient to reduce the salt. Sometimes the salt may cause increased itching and also increased some protein-rich foods like the nut items or the chicken and the non-veg items. We are advising the patient to reduce or maximally stop this protein-rich food because the protein compound is already containing protein has already a compound known as a purine. Okay, the function of this purine in normal metabolism, it does not have any inhibiting action like that. But in case of dermatitis eczema-like condition, this purine will trigger the itching of the skin. Okay. So food items, they have to reduce the salt and also the increase the protein content. Then exercising regularly and wearing compressive stockings. For persons who are suffering from varicose vein, they should continuously wear compressive stockings. So next slide, please. So that we already discussed, that is regular exercise, then elevating the legs and avoiding tight clothing and avoid standing for long period. So this picture represent that what the things, that is raising the leg above and then compressive bandages, then apply some moisturizing cream around the ulcer and avoid smoking, eat healthy vegetables and regularly walking. So these are the preventive methods. So this we have already mentioned. Next, the investigations. So what are the investigations? What when a patient is coming with varicose vein, we are going to do. So first one is the venous Doppler study. So the foremost thing is CBC. We have to look for the simple blood test like the CBC and the CRP. Okay. Then for varicose ulcer only, we have doing some specific investigations which include venous Doppler study. Okay. Doppler will find the amount of blood flow and also if any saphenofemoral junction blockage or any obstruction is there, the Doppler will be revealing the study. There are two types of Doppler available, arterial Doppler and also the venous Doppler. So when you are writing a Doppler advice to the patient, be sure that you are writing with an arterial Doppler or venous Doppler. So what is the importance of this arterial and venous Doppler, right? So venous Doppler we are usually doing case of this varicose ulcer and to find any obstruction. But in case of some case, we are doing arterial Doppler because sometimes there will be plaque formation. Plaque formation or the atherosclerotic changes will be there on the arteries, which are a consequence of this arterial ulcer. If the patient is economically well, check for both arterial and also the venous Doppler. Then check for the venography, that is by dye injecting method. And next study of the ulcer discharge to find the content in the ulcer and what type of this more commonly with the allopathic doctors. That is, they're using wash type of organism. Depending upon the organism, they are planning the way of treatment. Next is wedge biopsy, then X-ray. Why we should take an X-ray, right? We have to, the chance of osteomyelitis has to be ruled out, and the bone infections are also be ruled out. Next the most common thing is CBC. Here usually is the eosinophils will, the ESR will be elevated, and check for the CRP or the C-reactive protein. So the main investigations we have to check for a varicose ulcer patient is venous Doppler study, venography, study of the ulcer discharge, wedge biopsy, X-ray of the part, and the CBC with the CRP. So wound care. Wound care is the most important. So next slide, please. Wound care and management is the most important case we have to do in case of a varicose ulcer. Okay. Try to keep the ulcer infection free and to remove the dead tissues and the surface of contamination. So before doing any ulcer dressing, be sure that we are following all the precautionary methods for a dressing. That is, you should wear at least 2 gloves on both hands, 2 gloves, and you should wear a mask. Okay, if a Google is present, okay, we should wear it. If otherwise not, no problem, but you should compulsory wear a 2 sets of gloves and also mask. And clean the ulcer. Clean the ulcer. It is a, so we will be taking a management of ulcer and wound dressing in another class. We will be detailed discussing about the how to do the dressing along with the homeopathic dressing tinctures. Okay. Here we are saying that just clean the wound and remove the older dressing and clean it away, clean the ulcer. So do it and then from the center to the periphery. Okay, so from the center to periphery, usually we use normal saline for the cleaning. Okay, normal saline is being used for cleaning, and the dressing, the wound is to be dressed from time to time. So before dressing, one of the most important thing that we should know is autoclaving the instrument. Okay, autoclave the instrument properly before dressing. Sometimes when we are working in a hospitals or any other systems where we are having multiple cases of varicose ulcer, there is a chance that if a person is having some infection of the leg, usually another person, next coming person will also have a chance to develop that type of organisms in the body, and further the condition of the person will be worse. So it's our responsibility that we should be dealing with a wound dressing clearly, and we should not give any additional infection to the patient. Okay. So before so autoclaving that we will discuss in another class. So autoclave is a high pressure system which maintains the disinfection action of the surgical instruments. Okay. After proper autoclaving of the machine, clean and dry it, and also dress it. So try to keep the ulcer infection free, and at least offer dressing times a day, and always dress the wound from time to time, and maintain cleanness and dryness around the dressing. Okay. Next, the homeopathic management. The homeopathic remedies for varicose ulcer. So there are many remedies for ulcer, but for specific varicose ulcer, we have the 3-mark medicines: causticum, lycopodium, and pulsatilla. The 2-mark medicine it include arsal, calcarea, carbovesh, cardus, uric acid, lacasis, silesia, sulfur, and zinc. 1-mark medicine it includes anagals and graphitis. So these are the main homeopathic medications for varicose ulcer: cardus, graphitis, amamelis, pulsatilla, restox, sulfur, mercurius, aurum, carbovesh, lacasis, nitric acid, thuja, iodine, calibyte. So the appearance of the ulcer calibyte is punched out ulcer. Punched out ulcer. In nitric acid there will be irregular ulcer. Then mycelium, arshal, calcarea, lacasis, and lycopodium. So fluoric acid. Fluoric acid, varicose ulcer that comes with a severe burning pain. Okay, fluoric acid, there will be varicose ulcer with a severe burning pain, and ulcer have red edges, and there will be formation of vesicles, itching and burning sensation, and swelling leg, and relief by using cold application. This is the characteristic symptom of varicose ulcer. So next slide, please. In case of fluoric. So next slide. So next lacusis. So lacusis, the surface of the please share answer next slide. So lacusis, the surface of the ulcer is uneven and looks dirty and purplish, bluish black. Okay, bluish black appearance, and there may be burning sensation of the ulcer, especially at the night. So lacusis varicose ulcer. So more than lacusis mentioned for varicose ulcer. Okay. So the surface of the ulcer is uneven and looks dirty. There will be purplish and a blackish appearance of the ulcer. And burning will be there, and there will be. Sir, please, slide is not moving. Indicated from injury or varicose ulcer that arises from injury. The surface of the ulcer is uneven and looks dirty. The skin around the ulcer looks purplish or bluish black in color. There will be burning sensation in the ulcer at the night. Sir, next slide, please. Sir, please share the slide.
Dr. Hibbert, it is not moving now. Yes.
So next slide, sir. Sir, next slide. Next slide, sir. Sir, calendula. So next we are going to discuss calendula. So calendula is a excellent remedy for cleaning of the ulcer. Okay. For wound cleaning, calendula and carters are very much excellent. Okay. And varicose ulcer with a lot of pus discharge. There will be pus from the ulcer. Inflammation, stinging and pain, stinging pain in the ulcer is present. Ulcer will be deep and red in color. So the medicine is also used as a preventive measure against gangrene development. So this medicine acts as a preventive for gangrene development. Next is carbovich. Carbovich, because ulcer that bleeds easily even on slightest touch. Okay. In carbovich, there will be varicose ulcer that will be very sensitive. The ulcer that has a purple color and the skin surrounding feels tense. Foul smelling pus discharge with the blood may also present. So in case of calendula, there will be pus discharge will be there. In carbovich, the pus will be offensive. Next, graphitis. Graphitis for varicose vein with the itching and cramping. Then vipera. So vipera is one of the best remedy for varicose vein. Varicose vein with the cramps in the lower limbs. The patient has to keep the limbs elevated to avoid pain. Next is Bellis perinis. It is the best homeopathic remedy for varicose vein during pregnancy. And Calgary fluid is also one of the remedy. Then varicose vein with the bruises and aching in the limbs. Marbled skin appearance. Next is pulsatilla, varicose ulcer with itching. The ulcer look red and hard to touch. There will be smarting, shooting pain, burning sensation will also be there. There will be greenish, yellowish discharge. So we have discussed there are many medicines for varicose vein and varicose ulcer. Some of the important medicines include Cardas, Graphitis, Hamamelis, Pulsatilla, Restox, Mercurius. Mercurius is also an excellent remedy for ulcer. Then Calibic, Lacasis, Chloric acid. So we are going to discuss the case now. So here is a case of 68-year-old female who came to the OPD on 15 July 2014. The complaint was of painful ulceration. It was yellowish in color on the lower part of the leg on the dorsal aspect. So she had the complaint since 5 years and she was under allopathic treatment. So ulcer, oozing of the pus from the ulcer, which got aggravated by walking, and there is a offensive odor. The patient is very sensitive. So history of varicose ulcer since 5 years, and she is under allopathic medication. Next slide, please, sir. Then past history of hypertension before 8 years and under allopathic medication. Then physical journal, the patient was moderate built, well nourished, appetite, thirst, stool, all was normal, and urine is also normal. Then mental journals, the patient was highly loquacious. Okay. Then symptoms, pain, ulcer, painful, and burning. Personal history, mixed non-veg, thirst normal, desire soft food, sleep disturbed due to the complaint, thermal hot, and BP was 140 and 70 on medication. So the patient was hypertensive. So this was the repertory chart. Extremities, ulcer lower limb, extremities, varices lower limb, generalities, varicose vein, ulceration, generalities, wound heals slow, mind, loquacity, talkative, stomach desire, sore acid. So the medicine came was Lacasis 16 bar 6, Calcarea 12 bar 6, Sulfur 12 bar 6, Arsalv 11 bar 6, and Carbovich 12 bar 50. So the prescription was Lacasis. So lacasis 1 was given 2 doses once in 2 weeks, and dressing was done with calendula tincture. C&D was done every morning and evening. So calendula 200 potency was given 3 pills. These are the 7 doses. So this is the picture before treatment. Sir, next slide, please. Next slide, sir. So this is the picture of the ulcer before treatment. You can see that ulcer was very deep. Okay, there was a deep ulcer, and each time when she actually have varicose ulcer on both her lower limbs. Okay, this is the when she came to the came to the hospital, she was having more problem with the left leg, and the right leg was okay for 5 years under allopathic medication. The right leg was okay, but the left leg ulcer was like that. So after lacasis, this was the condition after treatment. So this totally there was 7 doses of lacasis was given, and there's a 3 months of treatment along with the calendula 200 and the cleaning and dressing. So there is a conflict of interest nil. There's no funding, and informed consent of the patient was taken. So these are the references. So varicose vein, and also the complication of varicose vein, that is the varicose ulcer, is been increasing, and there are conventional treatments available for varicose ulcer, that is the RFL, frequency ablation, and also varicose sclerotherapy, and also the surgery for varicose ulcer are prevalent, but these all are very costly, and there is a chance of recurrence is also very high. So our homeopathic treatment provide the complete cure of the patient without any further recurrence of the patient, and also offering an economically good support to the patient. So I thank each and everyone, especially Danesh sir, Manoj sir, and each and everyone of IFPH for giving me an opportunity to present. Thank you.
Thank you, Dr. Amrutha. It was Dr. Hibbert who has done the screen sharing for us, and he was very busy with uploading the videos of the sessions every day. Even in this crisis condition, he was the person to assist us. This is what is Dr. Hibbert is all about. So thank you, Dr. Hibbert, once again, and really a very good session. As we all know that this varicose ulcer is common nowadays among people above 30 or 40, and particularly people around menopause as far as the ladies are concerned. Even though there is varicose vein in their leg, but the problem usually arises at the time of menopause, or sometimes it may be a little bit before menopause. And anyway, the case, you took the case in detail, and what we find that you stick on the remedy, that is lacasis, the medicine, lacasis, and then you are able to prescribe the medicine as and when it required. Only 7 doses in 3 months. That give a beautiful result. It was a big one. Nobody from the other side believe that such things can happen with homeopathy. This is really a beautiful session. I invite Dr. Hibbert to say a few words on the presentation.
Doctor, it was a very simple and nice presentation. Can you hear me?
Yes, yes.
Doctor, I want to ask you whether she is diabetic or something like that. Any other complaints? Sugar?
Sir, she is having hypertension, and she is non-diabetic, sir.
Dr. Amrutha, you may open the video so that we can see you also.
Sir, now I'm at home. What is
Doctor, which actually there was a scar on the left side also, right side also, which was the one where the patient began the ulcer, whether it was on the right side or on the left side, or
Sir, the patient is having ulcer on both limbs. Okay.
which
So
one?
past 5 years, she was having ulcer on both her lower extremity, and the right side is already after the treatment it has healed, but the left side ulcer was still like that.
The question is,
And
which one was the first one? whether it was on the right or the left. Then it shifted to left and to the both side, or whether it began on the left side and then it went to the right also, then it continued with the both side.
So it was on the left side, sir. Left side was a chronic ulcer.
No, it seemed that the first one may be on the left side.
Yes, sir.
Anyway, using this calendula 200, that really a very good sign. But you never use any this no source here.
No, sir. No source was used. The calendula tincture along with the calendula internally, and also regular dressing along with this glycosis was given.
Okay. No biochemic was used.
No biochemic was used.
Okay. Thank you. That's a very typical classical prescription. Yes, Dr. Rampari, sir, you can speak. If anyone want to have a question or want to talk to Dr. Amrutha, please raise your hand so that we will allow you to unmute yourself and you can speak now. Yes, Dr. Rampari, sir.
Thank you, Dr. Dhanesh ji, and Namaskar, Dr. Hubert De Silva ji, and very congratulations, Madam Amrutha Madam. Very nice presentation, very coach vein, the treatment of difficult treatment of homeopathic science. But curative way of treatment in homeopathic science, carbohydrate is a very good remedy. And like aces, carbohydrate, Thalassia, calendula, very good remedy. Very important role of varicose vein. Carbohydrate symptoms, carbohydrate blackish and blackish color and wounds, sensitive pain and lack of oxygen, vitality drained. Carbohydrate is a very good remedy. Carbohydrate, varicose vein. Very thanks, madam. कार्बोवेज लकड़ी वुड से प्रिपरेशन हुआ है, जो जलाकर, तो जीते लकड़ी मरते लकड़ी देख तमाशा लकड़ी का, जीते लकड़ी मरते लकड़ी देख तमाशा लकड़ी का। तो कार्बोवेज का जो है, हाँ, थैंक यू मैडम।
Sir, which potency, sir? Carbohydrate, which potency you are using?
200 potency. And calendula Q and calendula 30, 200 potency. Lacasis is a very good remedy, left side of varicose vein.
Thank you, sir.
Thank you. Very thanks.
Thank you, sir.
Yes, there is a question from yes, sir, you have added one more remedy for that. But frankly, Dr. Amrutha is a person who stick on with the classical homeopathy. That's why she took the case in detail and find a remedy. She is no prejudiced to say that it is a case of lacosis or carbohydrate, but she want to make it sure that it is a right medicine. That's why she took the symptoms in detail and then she repertorized the case and find out that this is the remedy, this is the medicine. Then this is I have to give this medicine in a particular dose to this patient. So there is no prescription like any organ remedy prescription by herself. It's simply just a classical prescription. And this is what I would like to add to. Am I right, Dr. Amrutha?
Yes, sir.
Yeah, this is the method you always follows in chronic diseases.
Yes, sir.
Okay. Then, if anyone want to speak here, there is a yes,
Somebody asking whether we have to give the account number
yes,
for
definitely.
the contribution.
Dr. Kishore, you are there in our India group, or you are from which part? Dr. Kishore? Okay. I shall share. Please share your number to me so that I shall.
He is from near your place.
Yes,
Cherthala.
yes. I have seen that. That's why I asked such a question. Anyway, congratulations and thanks for your dedication to homeopathy, Dr. Amrutha.
Thank you, sir.
Then, what kind of procedure whether you are treating acute diseases in your clinic, then what is the modus operandi of that practice?
Sir, in acute cases,
Same that is the report.
Sir, in acute cases, maximum I stick on to single medicine, but in some case it will not work. Then I go for some combinations. For example, in case of fever, looking for the totality, sometimes bell brake pulse does not work. Sometimes I may go with the sperm pulse or sometimes of baptisia like that.
Yes. People, yes, Dr. Manoj is here waiting for. Yes.
Yes, thank you, Dr. Ganesh. Nice presentation by Dr. Amrutha. Congratulations. And we are hoping the future homeopathy is safe in your hands, like you, people like you. And of course, we know that it's a local maladies and a lot of chronic diseases. So definitely the antiparasitic medicine is of much service. Moreover, such cases, the other systems of medicines are often failing due to the troublesome manifestation of disease. So wonderful presentation, and also your is very beautifully compiled. Unfortunately, some technical problems arise. Anyway, it was surpassed by Dr. Hubert De Silva's timely interference. Help from Dr. Hubert De Silva. Thank you, Dr. Hubert De Silva, for that. Congratulations, Dr. Amrutha. Please come again. Thank you.
Thank you,
Dr.
sir.
Dr. Selby. Selby was there. No.
No, he's not there.
No, she went away. Dr. Ambadi? Ambadi, madam, you can make your comment here. Please unmute. Uh, Dr. Amrutha, can you make a 2 minutes conclusion on your presentation? Just 2 minutes, so that we want to make some slide for that. You can just come out simply
Okay, sir.
a short
Sir.
description. Yes.
Okay, sir, varicose ulcer. So varicose ulcer occurs as a complication of this varicose vein, and there are mainly the females are affected more, and also the occupation ways, mainly teachers, bus conductors, like that, they are affected more. And the main pathophysiology lies with the defective valvular system. Okay, incompetence of the valve or the valve problem is the main thing. The main pathophysiology is the venous hypertension. Okay, venous hypertension in the lower extremity, then it lead to the edema formation and capillary permeability. All this condition also arises, and there will be decreased oxygen absorption and carbon dioxide removal. And the ulcer, before the ulcer formation, there are main six things we have to look for. So first is the spider vein formation of the in the lower extremity of the patient. The spider vein formation ultimately lead to the varicose vein, and later it lead to the edema. Then skin changes will be there. There will be itching of the skin. The skin permeability will be increased, and later it leads into the varicose ulcer. And the main management of the varicose ulcer is weight reduction and also exercise and regular exercise, and then avoid smoking like that. So we have many medicines that act externally in varicose vein. And the foremost important thing is that we have to look for the investigations. That is, the venous Doppler is the most important thing, and also venous venography, along with the CBC, CRP, and also check for the X-ray, X-ray, and also wedge biopsy. Wedge biopsy. Sometimes when we are treating only for varicose ulcer, there will be a chance that sometimes it may lead to some malignant growth like that. Mostly it will not be like that, but the wedge biopsy will rule out that condition. Then wound care. Sir, kindly give me one chance to share this ulcer dressing procedures and also the homeopathic management of ulcer.
Yes,
Sir.
yes,
So,
yes,
okay, sir.
definitely. Homeopathy can do such wonders with this kind of diseases. Thank you, Dr. Amrutha. Now I
Thank you
invite
very much, sir.
sir to say vote of thanks to the session also. Yes,
Yes. Thank you, Doctor. Hello, Doctor Arati Dukhar Damarwa. Kinds of veins, varicose, inflammation of veins, Neharwa root. So, according to Sast, अहंकारति दुखद डमरुआ मद कपट मद मान नेहरुआ. मन में कुछ और बोलता है कुछ, करता है कुछ, उस व्यक्ति को इन्फ्लामेशन ऑफ वेन होता है, जिसके कारण से वेरिकोज वेन होता है. तो थैंक यू. हाँ, थैंक यू मैडम. behalf of IFPH, very thanks. Excellent session. Behalf of again presentation. Thank you. Very thanks.
thank you. Thank you, Dr. Ramparesa, sir. And tomorrow we will have a session from Dr. Hina Rall, and she will be talking about management of cases with the paucity of symptoms. With that, we come to the end of the day, 1548. Thank you, Dr. Amrutha, and those who participated in this session. Thank you all.
Thank you.
So over to our Malayalam moderator, Dr. Manoj.